Coming back, another part. Here we are in another part right now, and we'll just talk about some points in the PSW's work. Here, as example, is a room in a long-term facility. As you see here, the rooms in the long-term facilities, like you want the patients to feel, or the clients to feel like they are in a home, not in a healthcare institution or healthcare providers. So you just give them, afford them, like seats here, like this is armchair seat, and here is another seat as well, chair, arm seat, chair, and here is another chair, and here's side table, and here is the bed. Though it is a clinical bed, but it looks like in the room like it's a part of the furniture. And here you will find light shade, and here you find yes. And here like statues and things that make the client feel like he's at home, is not, so he doesn't feel stranger, or he doesn't feel the loneliness. He will feel like he is at home. So this is the point we want to talk about now. Now we want to go to move to another part, which is the nursing home care. Is what is better, the things, the advantages and disadvantages of nursing home care. So the advantages of nursing home care, as you see here, and I will just enlarge it so everybody can see it properly. Then we will just put it down back. The advantages, safety and security, because it's a senior, if a senior falls under the supervision of a nurse, it is a time to think about 24-hour supervision. This can be provided by nursing homes. Also, nursing homes can be secure for people with Alzheimer's or dementia who might be prone or wandering. Like as example, those kinds of people, they need a special care. So the best thing for them is home care. Socialization. The nursing home activities will ensure the seniors to feel active and engage always. So there will be a direct contact between the nurse or the PSW and the patient in this case. These are the advantages of the home care and the advantages. What about the disadvantages? Lack of individual approach. Nursing home, this is the disadvantage of the nursing home, have typical plans for seniors with similar conditions. Thus, there is not much of a personal approach to each individual senior. So you don't have a special touch or a unique service will be applied for each client or patient in the nursing home in particular, or for himself. The service will be common for everyone who's having the same problem or the same issue. High price nursing homes also is not free. It costs. So nursing home care costs a lot, particularly for patients with special needs. Also, this transition periods is 16 years come sometimes to start feeling like home in a nursing home, because it's not that easy that they will feel that they are home quickly. No, they won't be quickly feeling that they are at home. They will still feel like a stranger, and this might take with them sometimes till they become feeling that they are really at home. They often feel alone and abandoned without their families, friends, and surroundings. And this is another point. So they will also feel alone. Now we will go to the principles also for the free healthcare services. The free healthcare services, the pros. All can access to healthcare. This is the free healthcare. Saves money, like the hospitals as example. Eliminates the competition. There is no competition. Hospitals do not compete. The governmental hospitals, they do not compete with each other. Removes third-party involvement. There is no third party like nursing homes or whatever. No, here the patient and the staff, the long-term services provider like the hospitals, and there is no also a direct contact like home care or whatever. No. Lower class and their children are beneficiaries, as example, encourage health care. less stress of authority for authorities, boost economic, that's very fine, health awareness and responsibility as well. But the disadvantages, long waiting for patients, yes. If you have, as example, four beds in each room and you have a waiting list, so there will be, expect in the free healthcare like the hospitals, that there will be a long waiting list. Descend the quality of care, of course, there is, since there is crowd and it's highly demanded and the supply is less than the demand, so expect the quality of care will go down. Minimal payment, and we refer to this point when we were talking about the Canadian care system and its relationship to other systems in the world. It doesn't come in a frontier ranks. It's not in the top, but it just decreasing. And yeah, minimal payment for doctors as well. So in the hospitals, like you see, there will be a minimal payment for doctors. Inaccuracy in diagnosis. Sometimes the diagnosis is not right. And this is a big problem in the hospitals because like high traffic in the hospitals. So expect there will be mistakes from some doctors or some physicians who are working in these hospitals. Minimal budgets for healthcare as well. So the healthcare in the hospitals are having a minimal budget. Like most of the things we said before when we started, that only like around 8% hospitals, but most of them home care. Okay. So here they give a minimal budgeting as well. No competition, no innovation, since the hospitals are run by the government. So no competition between government and private agencies. So here there is no innovation. As long as the innovation will arise from the competition. Careless about healthcare, and this is another point. Many factors are to be navigated. So here, these are the pros and the cons of the free healthcare, like the hospitals and so on. So we can say now the advantage and disadvantage of the nursing home, and we can say also the advantage and disadvantage of the free healthcare, like the hospitals. I will just add a slide now, and we will put these two questions, and I'll stop here for a few minutes for you guys to get the answers. Discuss. Here we go. The pros and cons. Pros and cons, of course, means the advantage and disadvantage of the following. Healthcare systems. Healthcare systems. First of all, free provider, which is hospitals. Of course, it's a public or governmental hospital. This is the first one. Second, the nursing homes. So we have to see the advantage and disadvantage of the hospitals and the nursing home. We will just stop here for a few minutes to get your answers, guys. And just I will put only one drop only one line. That means that it's only for a one line, but you know that you write more. So try to gather the information, like we said before, in this part. Nursing home, sure about that, nursing homes and the hospital. So we have here two things. We have to talk about the nursing home and we have to talk about the hospitals, the advantage and disadvantage of both the system. Time to answer this question is around 5 minutes. We'll pause here for around 5 minutes. Please return back into your notes and make notes about this, the advantage and the disadvantage of the pros and cons, like you see here in front of you, the pros and cons of the free healthcare, which is the government, and the pros and cons also of the home care or the nursing home. Okay. You have 5 minutes to do this purpose, please. Thank you. So in the first part, we talk about the pros and cons of the healthcare, the hospitals, and the nursing homes. We talk about the pros and cons of the hospitals and the pros and cons of the nursing home. We'll move forward now into a new point. We'll move forward to an noid. Still, and we have also some points like it can be lonely despite alarm system and regular visits from carers. You can still be at risk. There's also some back or drawbacks in the nursing homes or home care. Home modification and equipments can be unsightly and can affect the value of your property as well. You might not like support workers coming into your home. This is another point. You might not like support workers coming into your home. So the home care itself sometimes have also its own disadvantages. Home care disadvantages, we're still talking about. Like we said, everything is having advantages and disadvantages. So home care disadvantages. It may be prohibitively expensive. Yes, home care is very expensive. All your belongings will need to fit in one room. In the home care, yes, all the things which you need, you will put it in one room. All your belongings will need to fit in one room. You might feel that you have lost some of your independency because someone is sitting in front of you, the PSW or whoever, or RPN. In that case, you won't feel like comfortable because you will feel always that someone is there, so you don't feel independency. Pets might not be allowed, yes, and also you might not enjoy the company of the other resident in the home. So also this is another point that you might not be very like very happy with someone who's sharing with you the room or whatever. Health, wellness, illness, and disabilities. Now we'll talk about the stress. What do we mean by the stress? We will talk about some things like the Global Department of Health, the meaning of the stress. World Health Organization determinants of health. Determinants of health for the World Health. So this means the determinants of health means what will affect on the health. What will affect on the health. So the social gradients, stress, early life, social exclusion, work, unemployment, social support, addiction, food, and transport. So those are the points which will affect. So those are the points which will affect on their health. We call them determinants of health or health determinants. Okay. Now we'll go to Canada determinants of health. Canada determinants of health. So in addition to the word health, we have here income and social status, social support and coping skills, education and literacy, employment and working conditions, physical environment, healthy behaviors, childhood experience, biology and genetic endowment, also access to health services, gender, culture, and race or racism. These are the things also which is considered like Canadian determinants of health. I would say again, the income and social status, social support, and coping skills to deal with. Coping means deal with the people, skills of dealing with the people, education and literacy. Of course, this will affect on the health. Some people prefer, as example, home remedy or whatever based on the level of education, employment and working conditions, physical environment, healthy behaviors, childhood experience, biology and genetic endowment, access to health services, gender, culture, and race. These are the things which will affect on the Canadian on the health. The Canada determinants of health are those factors. These are the factors which affect the health in Canada. Also here, we talk about the illness and disability here. We talk about the illness and disability. But let us put question here now and add now a question and say in a new slide, what are the main determinants of health? And I will stop here in this part for you to make notes about it. What are the determinants of health? What are the determinants of health? Stop here a few minutes to take an answer about this question before we move into the next question. Remember, in this lecture, we talk about in this part, we talk about the advantage and disadvantage of the home care. We talk about the advantage and disadvantage of the hospital care. We're not talking, and also the advantage and disadvantage of the nursing home. Now we move in to talk about the determinants or the factors that affect the health service or the health. Determinants of health means what are the factors that affect the health. So here now we have the World Health Organizations, WHO, the World Health Organization's determinants of health. Then we have also the Canadian determinants of health as well. Canadian determinants of health. We have both of them, and almost both are the same. But in Canada here, it's more explained. There's more explanation for it. It's more explained, like more detailed. Like it's more detailed here. So I'll stop here for 2 minutes so that you guys can tell me what are the main determinants of health. What are the main determinants of health? Shall stop here a few minutes for you guys to tell me what are the main determinants of health. So we'll move to the next slide now and check out, we talk about what are the main determinants of health, either which is determined by the World Health Organization or by the Canadian health system or by the Canadian health system. We'll move now for the reactions to the illness or disability. Reactions to illness or disability. We have joys and happiness, fear and anxiety, sadness and grief, depression, increased hunger, loss of bowel and bladder control, denial and anger. So these are the way how the people react into the illness. How will people react into illness? Joy and happiness, some people will react for the illness or disability with kind of joy or happiness. And this is rare, it's not too much. Fear and anxiety, everyone is fear and everyone is anxious of the illness. No one like to be ill, no one like to be sick. Sadness and grief, most of the people when they get sick, they goes down this category. Sadness and grief. Depression, yes, some kind of sickness and sometimes some kinds of illness will lead to depression. Some kinds of illness also and disability will lead to increased hunger. Some kinds of illness and disability will lead to loss of bowel or bladder control or denial. Denial means try to deny that you are sick. You don't want to admit that you are sick or you have a disability or whatever. And some people will react to the illness or disability in a sense of anger, getting angry, getting upset because they are sick. These are the ways people react into the illness or disability. I will say again, joy and happiness, fear and anxiety, sadness and grief, depression, increased hunger, loss of bowel or bladder control, denial, and anger. These are the things which the people in common react into the illness or disability. These are some explanation for these facts, for the facts of reacting for the illness, for reacting into the illness. Fear and anxiety, whenever minor illness can cause anxiety. It is understandable that clients with serious illness have many fears and anxieties. That's true. See, as example, the people who get cancer or the people who get disabilities or whatever, they always feel always very anxieties. How they will manage their daily responsibilities, financial issues. Like as example, if I get injured or I have back pain or whatever, then how I will live, how my family will live. Like these are the things which the people concerned about. How will be my income? How I will get my pay? How I will win my bread? Their family's future and this and so on. Some clients worry about any changes in the rule within the family units. Also, will I be something that my family will carry, bear me on? These things will be like hard, give me a hard time, like after I was responsible, now I became sick and I'm kind of obligation for everyone in the family and kind of responsibilities after I was carrying the responsibility. When I became sick, now everyone is carrying my responsibility. And do they like it or no? Clients with disabilities, disfigurements, or speech or memory impairments may worry about embarrassing themselves in front of others. That's true. Clients with mental health disorders often experience severe anxiety. Some of the fears of the clients may make sense to you as a support worker. So you as a support worker, you have to know, to understand the fear and anxiety of or the reaction into the illness or disability disability. So you have to deal with it based on this accordingly. You have to know that this kind of people, these people are having their own problems, and this illness caused them fear and anxiety. And you have to be aware of this and have to know how to treat with this. So you as a personal support worker have to know about the fears of the clients. Makes sense that you as a support worker, others may not. To the person experiencing the fear, however, it is real. Some clients will communicate their fear and anxiety to you. So they will start like complaining to you about their fear and anxieties. Remember, as a PSW, you are the one who's having a long contact with the clients. You have like if you have 8-hour shift or 12-hour shift, you're sitting in front of the client directly. Client is always talking to you. Client, especially when you are in a regular visits to the client, you become part of the life of the client or the patient. You will be a part of his life. So based on the social needs for the client, he might start talking to you. So you have to know all this, consolidate him, and treat him emotionally and with passion. But many will not, and many prefer to keep their concerns to themselves. Some people sometimes keep it hidden inside themselves. They don't like to express their feelings, their fear, their point of weakness. They don't want to show it to the others. This is you as a PSW, you have to know how to deal with the people who has fear and anxiety. For that reason, we will go now to another new slide, and I will tell you here how can a PSW, how can a PSW how can PSW deal with fear and anxiety of client? Of course, this is because of the sickness or the illness. So this is due to illness. So this is due to illness. How he will deal with due to illness. Due to how can a PSW deal with fear and anxiety of client due to illness? So how he will deal with the situation? What will be his reaction? Also, here you will find some points for the disabilities, like people who has disabilities, they have these common emotional reactions. As example, confusion, denial, disbeliefs, anxiety, fear of losing control, panic, inadequacy and humiliation, anger and frustration, sadness and crying, guilt, hopelessness, despair, disorganized. They will be disorganized because they'll start like to feel confused, like fatigue, loss of interests, withdrawal from any situation. They don't like, sometimes they feel like they don't like to see the people, they don't like to act, they don't like to progress in their own communication with the others. You feel also loneliness, isolation, and this is another point. Those are the points. And here also, these some points common reactions to persons with disabilities. A personal support worker must know about all this. He must know about all these points. And he must know how to deal with the people who have a panic reaction due to illness or disability. So he must be aware of all this. There are common reactions like the dread. See, things also this common reaction to persons with disabilities: dread, embarrassment, shame, pity, disbelief, disregard, and discount, dehumanize. These are the things people with disabilities always feel. when they are encountering a disability situation or happen to them something like an accident or whatever, or a stroke, out of stroke or whatever. Now they are a kind of other person. But what's your rule as a PSW? My rule as a PSW is to help these people as much as I can. Understand the reasons behind their anger, the reasons behind their grief, the reason behind their panic, their denial, the reason behind their embarrassment, the reason behind their shame, the reason behind their loneliness, and so on. I know how to deal with these points. So here now, I will go to another question, and I will ask you here, it's already there. How can a PSW deal with fear and anxiety of client due to illness? A client who has illness, and this causes him to be fear and anxious. How can I, as a PSW, understand it? Like I said before, we have to comprehend the situation, understand the consequences of the illness and the fear, and deal with it accordingly. I will give you here a few minutes for the answer of this question before we move to another part. So this is about the sickness, illness, or disability. Before we move into the second part, which is the depression. So please make notes here before we go to the next part. Please make notes before we move into the next part. Thank you.